So at this point, I'd like to turn it over now to Dr. Sean Hamilton, a rheumatologist here in St. John's, and he's going to share with you some of his comments.
Thank you, Brendan. I'd like to, first of all, thank the NLMA for organizing this event. It's very important for us to be able to get we'll say, what we need to let people know what's going on with rheumatology. And also, I want to thank the media as well for coming today for this event. So our objectives are to, first of all, describe what rheumatologists do, and also to describe what the current situation here is in Newfoundland and Labrador, and also hopefully to make some suggestions as to how we make things better. Now, first of all, what are rheumatologists? Well, rheumatologists are physicians, are medical specialists that treat people with musculoskeletal problems. It takes about, I guess it takes about 12 years to make a rheumatologist. It takes 4 years of pre-med, 4 years of medical school, then 5 years of training in rheumatology and internal medicine. So it takes around 13 years. So we are, I guess, a rare commodity. And what do? We treat patients that have medical conditions such as rheumatoid arthritis, ankylosing spondylitis, lupus, patients that have SLE, that is, gout, osteoarthritis, and the list just goes on. We treat potentially 100 different conditions. Now, most of the patients that we follow in the long term are patients with inflammatory joint disease, such as rheumatoid arthritis and ankylosing spondylitis. And also, even though there's 100 different types of, we'll say, rheumatic conditions, there are no two patients with the same that have exactly the same type of conditions such as rheumatoid arthritis. So, in other words, rheumatology takes a lot of time, and you can't rush rheumatology care. In Newfoundland, as Brendan alluded to, there's at least 89,000 patients with some form of arthritis. So you can see obviously the need for rheumatologists, and for adult rheumatologists for the province is just not going to cut it. Now, I just want to talk about some specific points here. First of all, the numbers of rheumatologists. We have a population in this province of over 510,000. Now, we need approximately 7 full-time rheumatologists to look after our needs, at least 7. That's about 1 per 75,000 people. If you look at a country like Sweden, Sweden has 1 rheumatologist per 50,000 people. So you see, we're not asking for the bank here. We're just asking for 1 rheumatologist for about every 75,000 people. At the present time, we have a total of 4 adult rheumatologists. Now, unfortunately, because we do other things, some of us do teaching, all of us do teaching at the university, and some of us do research. So when we work it out for 4 of us, we have a total of 2.5 full-time rheumatologists for the province that do clinical work. So if you do the math, we would need approximately 10 adult rheumatologists to give us, we'll say, 7 full-time rheumatologists. Right now we have 4, so we need at least 6 more rheumatologists. Now, as the media may know, back in January there was in the media some talk about rheumatology outpatient waiting times. Now, back in August of 2008, we calculated the waiting times for inflammatory rheumatology conditions such as rheumatoid arthritis was about 9.6 months. And for those patients that have, we'll say, chronic non-inflammatory conditions, the average waiting time was 42 months. So with Eastern Health's help, we had to make some changes. And those changes were not good changes. The changes we had to make, we had to remove 1,000 patients temporarily from a waiting list. These are these patients with chronic non-inflammatory conditions. So obviously we need more rheumatologists to see these patients. Now, with the current number of patients waiting to be seen with what we call urgent and semi-urgent problems at about 600 plus, these patients that are temporarily removed from our list there's no way we're going to see these patients very soon. It's going to take a while. It's going to take more rheumatologists for us to do that. And now let's talk about demographics, for instance. Our patients, our population is aging. The boomers, people like me, are getting older. We're getting problems. And this means the workload based on demographics alone is going to increase astronomically. So it's estimated in about 30 years from now that the prevalence of rheumatoid arthritis given our population may actually double. And then there's also lifelong follow-up. Because our patients have chronic non-curable conditions, such as rheumatoid arthritis, SLE, or lupus, we usually follow these patients for long periods of time, sometimes for the remainder of their lives or maybe for our lives. So if we continue to pick up new patients every day, you can imagine how the numbers increase over time. For example, I still follow the first patient that I saw 23 years ago. So since that time, I've seen another 8,700 patients. I don't follow all of those, but I follow many of those. So you can see the numbers are just astronomical. And also state-of-the-art treatment for rheumatic diseases. Patients with rheumatic diseases deserve good treatment. Now, good treatment means that patients, say with rheumatoid arthritis or SLE or ankylosing spondylitis, should be seen once every 3 to 6 months, because oftentimes the treatment needs to be changed. So given our current numbers, there's no way we can do that right now. And also, patients are becoming more complicated. As patients are living longer, they're having more what we call comorbidities, more diseases. So that makes management more challenging. Also, there's a lot more treatments to offer compared to 20 years ago. And also, patients' expectations have been raised. There's internet, et cetera. So given those issues, again, there's an obvious need for more rheumatologists. Now, as a specialty, rheumatology takes time. As many of our patients, for obvious reasons, are slow-moving due to the activity of their disease, and therefore, we can see fewer patients per clinic than other specialties. And also must make another important point, is the importance of teaching. When we are overworked service-wise, we don't have enough time to do enough teaching for our medical students and postgraduate trainees, such as interns and residents. And in the end, the patients will suffer. If we don't teach these medical students, teach these residents rheumatology adequately, then in the end, these graduate physicians will go out in the community, and they will not be trained, have enough training in rheumatology so patients will be treated satisfactorily. So that's another issue. And also with reference to family doctors, due to the shortage of rheumatologists, patients with these chronic non-inflammatory rheumatic conditions are, as I've said earlier, are being temporarily removed from the waiting list. So that means family doctors are taking over this workload. And this is also puts a tremendous burden on these individuals. Also, it's important to recognize that increasing the numbers of rheumatologists is obviously very, very important. But also, there's the team approach to the treatment of rheumatic diseases. If we don't have the allied professionals that work with us, the physiotherapists, the occupational therapists, if we don't have enough of them as well, that also plays a major impact on our ability to treat rheumatology patients properly. And lastly, let's talk about geography. We have 500,000 people spread over a fairly large landmass. All our rheumatologists right now are in St. John's, all to the east. So you must imagine that what patients that have chronic pain, chronic disabilities have to travel so far to see us. Just think of the pain and suffering they have to go through just to see us. Also the expense. So it's also important, very important, that we are able to recruit rheumatologists, to have rheumatologists outside of St. John's in places like Corner Brook, places like Gander, so that we can better treat our patient population. Thank you for your attention.